This 4-course lecture series that we're offering in our practices basically goes through the protocol in diagnosis and proper treatment and management of children who suffer from sleep-disordered breathing problems such as snoring, obstructive sleep apnea, upper airway resistance syndrome, classic mouth breathing. And I will be talking about what we do orthodontically, widen the palate, bring the maxillary mandible forward. My ear, nose and throat doctors will be talking about how they look at the child, how they examine the nasal valve collapse, how they look at large adenoids and tonsils, large inferior turbinates, etc., etc. Then we have oral myologists or MFT practitioners who will be showing how we strengthen the muscles of the pharynx to maintain the changes we've done. And of course our pediatric sleep physicians who will discuss the importance of looking at a child's sleep, ruling out things such as restless leg syndrome, etc. So my protocol over the next 4 sessions is child comes in, they've got a malocclusion related to their airway. How do we improve their airway? How do we fix their malocclusion? How do we keep it stable? And I work with a team, and the team is pediatric ear, nose and throat, pediatric sleep physician, oral myologist, orthodontist who understands the benefits of early treatment. So I hope a lot of you will tune in where we're going to be streaming this live, and everything I talk about, anything any of my specialist colleagues will discuss, we'll have literature references for you. Normally it's a 6:30 start and we'll go for 2 hours, and the references we can email you. If you want further information or you want to inquire, we're going to put my email down, info@mahony.com, and I'm happy to help you.
So what I learned today was more about bruxism, and I think I learned a little bit more about tongue ties and how they can affect the growth of the orofacial complex. So as a speech pathologist, I would change how I practice by looking at the cause of why some symptoms or disorders are occurring. Definitely looking at airway first rather than just treating the symptoms, and referring to appropriate professionals who can help us figure out why the disorders are occurring.